Good morning, everyone. Today is, what is today? Wednesday. I already have my little scarf on because it is raining. Hope everyone's having a blessed and wonderful Wednesday. I am getting ready to go to get my fluid infusion. That'll take about an hour, and then immediately after that I have to have an MRI of my brain and my neck. Sorry, put my numbing cream on. Best stuff around. If you don't want to feel your Metaport, ask your doctor for this, because what I've seen just by going, there's a lot of actual, like, you know, when you go to infusion, you have chemo patients, you have lupus patients, all different types of people there. They could be there for you know, antibiotic treatments. It just, you know, it's a variety of things. So I've just noticed that, like, just about all of the chemo patients that I've come across and talked to, none of the doctors automatically give them the numbing cream, which I think is the craziest thing ever. And I don't know if it's because I know about it, you know, from working in the medical field, but why would you want, if there's a cream that doesn't, you know, you put it on 30 minutes, you know, before you go, and put a band-aid on it, like, why would you want your patients to be in pain? I'm not saying that they probably just don't think about it, I guess, because they're not the ones going through it to know how painful getting stuck by, you know, in your chest. It's not like a needle stick in your arm, you know. And especially, like, I know I used mine pretty much immediately after I had it put in. But chemo patients, like, they literally will have their Metaport put in and have to go to treatment the same day. So yeah, that's the best stuff. So if there's anyone out there that has a Metaport, please have your doctor. It's just some lidocaine and some prolicaine, I think, is in there. It's a couple, two things, but it is so worth it, and it's covered by your insurance. So yeah. Sorry, I dropped the camera. I did get an email. The tripod that I ordered will be in tomorrow, but the one from my car won't come in until, I think they said the 6th. I don't know. Would have thought Walmart would have had one themselves, but it had to come from a third party. I don't know. But yeah, so I'm headed to the hospital to get that done, have these MRIs. The reason they are doing the MRIs on me, they think that I have MS or some other type of autoimmune connective tissue disease on top of my lupus. Yeah. So we're going to rule that out. Praying that it all is well. I had an episode when I was a teenager where I couldn't walk for about a week or two. So they did the whole MRI stuff back then, and they said it was fine, but they just, like, sent me on my way. No follow-up, nothing. But, like, when they check your reflexes with a little reflex hammer, like, my legs don't move, my arms aren't moving. And at first, it was only my right leg that was having problems. And they just said, oh, well, that's aside from when I had my back surgery. Which you'll see in the video that uploaded today. But anywho, so they were just like, oh, well, it's because you waited, you know, too long to have the surgery. And, you know, I tried to put the surgery off as long as I could, for the simple fact, I wanted to do physical therapy, some injections. I didn't want to have surgery. I worked for the neurosurgeon. I just didn't want to have it. I trusted him, don't get me wrong. I just didn't want to have to go through that. So they just contributed, oh, it was that. And then now then it started going into my left leg. And they were like, okay, well, that's not normal, but, you know, it just could be nerve damage or whatever. And I'm thinking to myself, okay, but why would my left leg be affected by something with my right leg? So now I told my pain doctor, I was like, you know, I'm having like tremors in my hands and I don't know why, you know. And there's cases where when I'm trying to walk, my legs feel like they weigh 5,000 pounds and I'm like shuffling my feet to try to just move. And so she was like, no, I need to send you to, you know, a neurologist. So this neurologist that I went to, she's pretty awesome. Like, she did a thorough workup and she was like, I'm not going to say what it is because I've got double vision, swallowing, I had a lot of stuff. So she was like, well, I want to get these MRIs because I had an MRI of my brain. I want to say it was this year, but the dumb people didn't tell me to get my Metaport access because they said that they didn't need it. And then they tried to stick me, you know, 4 or 5 times. And I was like, look, you know, if you got your pictures, you got your pictures. If you need me to come back, I'll come back once I have my Metaport. So they never called and they just said, oh, well, it's fine. But in order to test for MS or any neurological, you know, disease of the brain, you have to have it with and without the contrast. So that means I'm having to go back. I'm not happy about that. I probably should have called them because I don't want my insurance, like, you know, I have to pay 20% of everything. So I'm gonna find out about that. But anywho's, so she's doing the complete workup. So I know I go back to her. It's not till like late part of September to get the results. So I'll keep you guys posted. Feeling sluggish still. I did cook. It was like almost 9, almost 10 o'clock. But I did do the salmon croquettes. I posted a picture on my Instagram. And my husband finished them off this morning for breakfast. So I did make that because he was like, babe, I know you don't feel good. He's like, lay down, take a nap. And I'm thinking like, oh, good. I don't have to cook later, like an hour later. He's like, well, it's been an hour. Are you going to cook? And I was like, oh. So I got up. I mean, they're easy to make, but I just didn't feel good. So we didn't go to bed, I don't know, till probably, I don't know, I think I fell asleep about 11. But I was up off and on all night. Didn't wake up this morning. I mean, I got up because I think my cousin texted me or something early in the morning. Like I'm getting up that early. But so that woke me up. So, but I was hurting like all night. Just, you know, woke up. Now I have like a migraine like on this side of my head. I'm like, what the heck? So I was thinking, like, I know I feel crappy like this the week before my infusion because I get my Benlysta medication infusion on next Tuesday. So I always kind of feel, you know, cruddy or whatever anyway. But I mean, I had to think about it. I was like, man, this is just horrible. But I forgot I'm not on my Cellcept. So I've been off of my Cellcept when they started the second round of new antibiotics for this sinus and cold issue. So I can't take my Cellcept anymore until after my surgery on the 16th. Which, please pray for me. I just don't. I'm not trying to say I'm scared. I just don't. I know what happens when I was off of my Cellcept for 2 weeks before. And I think back then I was not even on Cellcept. Or maybe I was on Cellcept and Plaquenil at that point. And it took me off because I had diverticulitis flare. And that's how I ended up in the hospital on oxygen. And my breathing, like I checked it this morning because, you know, getting out of the shower is very bad. So it was like 96, which, I mean, I'm still in the 90s. But I can tell it that it's a struggle. I just don't know, because my rheumatologist wanted me to stop the Cellcept originally 2 weeks before my surgery. That way, if I had any kind of infection that has gotten into the bone area, that it won't be in effect. And then she said I would have to wait a week after surgery before I resume it. So that was 3 whole weeks of not being on it. But she's like, oh, well, you'll have your Benlysta to, you know, give you coverage. And I'm thinking to myself, don't get me wrong, the Benlysta works, but it works in conjunction with your other immunosuppressants. Because at first, when I was on Plaquenil, oh my God, it caused the worst stomach issues. I lost 70 pounds, which I wish I could have kept them 70 pounds off. But I was so sick. I was going to GI doctors. I couldn't figure out what was wrong, yada, yada. And then finally I went back to her. She was like, oh, you lost 70 pounds? I was like, yeah, I started telling you when I was losing 10 and 20 pounds. And she was like, oh, that's probably the Plaquenil. And I stopped it, and I didn't have any more, you know, stomach issues, you know. So, yeah. Sometimes you wonder where doctors' heads are. But you have to stay on them for yourself. You know, you can't just, I mean, because doctors have more than just, you know, you as a patient. So if you feel something's not right, you got to stay consistent when getting on these doctors, because, you know, they got a lot of stuff going on, and they probably are hearing you but not hearing you. So yeah, but I'm gonna pay attention on the road, and I will come back to you guys maybe a little bit during my fluids, or after the MRI, or before. Talk to you guys in a little bit.
What's that? Not in milk we want.
Hey guys, finally done with the MRI, back in infusion, waiting to be hooked back up to finish my fluid. So I'll see you guys when I'm done. Hey guys, I am done at the hospital with my infusion fluids and the 2 MRIs. I am so tired and so drained. It is 3:30, so I've been there since noon. I'm gonna try to go grab something to eat. I need to go to Walmart after all that grocery shopping yesterday. I forgot to get, I wanted to get stuff to put a roast in the crock pot, you know, so that'll be something I don't have to worry about for tomorrow. I just don't know if I can make it, like, I don't know. I need to get some cardstock paper to finish printing off some certificates for sponsors that we're supposed to deliver tomorrow. So I don't know. I'm just like confused. I don't know if I should just go to, I hate going to Office Depot because they're so super expensive compared to Walmart. So I guess I just have to suck it up. I just don't feel good. I'm just like, I'm over it. So over it. I just want to feel better. So tomorrow, if, you know, I'm able, I'll go with my husband to deliver awards for, you know, like I said, corporate sponsors. If not, he'll do it by himself. Friday, I have to get more fluids. And then on Tuesday, I get my Benlysta infusion. So it's just a lot right now. I forgot Labor Day was this week. Well, Monday. I forgot all about that. So what are your plans for Labor Day? I know we're not probably going to do too much of anything. I don't know if my husband's going to grill or not. Probably not. I brought him a new barbecue grill and a smoker when we moved into the house, and I think we've probably used it 3 times. So yeah, if we do anything, we might just do not the traditional barbecue. We might do just some shrimp or something, shrimp and steak, or I don't know, we'll see. So guys, let me try to find me something to eat, and then I guess I'll tackle this Walmart, which I really don't want to. I really need to go to Dollar Tree to get some more stuff for a DIY that I'm gonna be posting. I think it's DIY Monday on Monday. I'm not sure, because I said I would do it every other Monday, but I'm trying to decide if that's feasible or if I should just do it once a month. And that way the projects that I do just record them in advance, so I'm not, you know, struggling trying to keep up with doing it. And the only time I really do DIYs is just for home decor, you know, when I'm, or, you know, setting up a room and say, oh, this would be nice, let me see if I could, you know, DIY it. So I think what I'm gonna do, so you've already had one for August, so that was the which you'll see that collaboration on Friday, which some of you already saw it, because I didn't realize that, you know, at the time about the scheduling part of it. So that was a collaboration with Miss Kim Davis. So that will come out on Friday the 1st. So you'll see my DIY project. So that might just be, you know, that was my August one. So I may do, you know, one more for September, which I have several in the works. I just don't want to be stressed to try to get it out if I don't feel good. So yeah, let me turn this off and try to find somewhere to get me something to eat. So I'll talk to you guys a little later.